Hi guys, welcome to MedNuggets channel. Our discussion today revolves about the topic tetanus. Tetanus is caused by Clostridium tetani. Let's see the virulence factors. Two types of exotoxins. Number 1, tetanolysin. Number 2, tetanospasmin, which is a neurotoxin. It is also used in the preparation of toxoid. Pathogenesis. Toxin binds to the receptor, which is located on motor nerve terminals, which causes toxin internalization, retrograde transport to the GABA and glycine producing inhibitory neuron terminals, thereby prevents presynaptic release of inhibitory neuron terminals, leading to spastic muscle contractions. The mode of transmission is either by injury or surgery done without aseptic conditions. Let's see the clinical manifestations. Initially, the muscles of face and jaw are affected. There will be increase in the tone of masseter, which is known as lockjaw or trismus. There will be muscle pain, stiffness, and difficulty in swallowing. In neonates, there will be difficulty in feeding. Deep tendon reflexes will be exaggerated. Hands and feet will be spat. Autonomic disturbances is seen. That is tachycardia, intestinal stasis, sweating, increased tracheal secretions, acute renal failures too. Now let's see the complications. Number 1 is rhizus sardonicus. What does it mean? Which means spasm of facial muscles produce grinning. Number 2, opisthotonous position. And what does it mean? It means spasm of extensor muscles, and there will be spasm of respiratory muscles too. Now let's move on to laboratory diagnosis. To start off with the laboratory diagnosis, first we need the specimen, right? And what's the specimen collected? It is none other than excised tissue bits from the necrotic depths of the wound. And now we are going to do gram staining. In gram staining, we can see gram positive bacilli with a terminal and round spores. Gives characteristic appearance of drumstick. Let's see culture. Culture, we can use RCM broth. RCM, which means Robertson cooked meat broth, which produces foul odor due to proteolysis. And next we can also use blood agar with polymyxin B. Here you can see swarming growth of bacilli. And at last, to detect the toxin, you can do toxigenicity test. In vivo mouse inoculation test on serum and urine. To finish it off with the laboratory diagnosis, let's see prevention. Prevention is by vaccine. We can use monovalent vaccine, combined vaccines, and pentavalent vaccines too. The well-known combined vaccine is DPT vaccine, which includes diphtheria, pertussis, and tetanus. And the takeaway points are tetanus, which is caused by Clostridium tetani. Virulence factors are two types of exotoxins, tetanolysin and tetanospasmin, which causes spastic muscle contractions. Clinical manifestation is trismus or lockjaw. Complications of tetanus are rhizus sardonicus, opisthotonous position, spasm of respiratory muscles. Laboratory diagnosis: specimen collected is tissue bits from necrotic depth of the wound. In gram staining, you can see drumstick appearance, gram positive bacilli. In culture, blood agar with polymyxin B, you can see swarming growth of the bacilli. Toxigenicity test is done, and at last, prevention is by vaccines. Thank you guys for your support. I think so. I have made the video short and crisp. If you find the video worth, please do like, comment, and subscribe. Thank you guys. Bye bye.